Good evening. This is Dr. Bill Wyatt again with the American Orthodontic Society. And this evening I want to talk to you a little about palatal expansion and getting it to where you understand a lot more better. I say a little bit here, but just learn more about palatal expansion. This is something that happens to the palate as people have allergies and they breathe through their mouth and they keep their tongue in the lower arch and the lower teeth expand out past the upper teeth and the palate kind of shrinks in, and then the further it gets, the more it cuts the airway off, and the more they do this, and so it ends up, if they are doing this all their life, even though they may breathe through the CPAP devices, I use one all the time, you still have a short, limited airspace, and the least little allergy will close it up like this, or getting different things into the lungs by breathing into the mouth. We've had patients that were having their lungs treated, and if we opened their palate up and just gave them plenty of room where the allergy didn't actually close it down and just swell the tissue up, and they could still breathe through the palate, through the nose, and those people got along much better and didn't have to go to their see their lung doctor at all about this. So let's get started and kind of understand what we're talking about here. This is a case that we did several months or years ago. It was several years ago. It was a long time ago when we did this case. Now, this little lady has one of the worst palates I've ever run onto. Plus, she had a defect in the roof of the mouth, and we separated the palate, and it did not increase this size of this bone perforation in the roof of the mouth. Was about as large as a pencil eraser, and it stayed about the same size during the whole thing. She looks a little sleepy here, and maybe that's because she breathes through her mouth a lot. Now, let's just look at the models to start with here. Of course, she's got this crossbite right here, but look where the upper molar is fitting in with the lower molar. Here's the lower molar coming in like that, and the upper molar should be out kind of like this out here past it, so the cheek would keep the cheek from coming in there and biting it. Now, people who breathe through their mouth, there's no way that I know of that you can breathe through your mouth and not breathe on top of the tongue, and you get to where you just hold the tongue down here all the time, and your palate doesn't get this expansion of the proper swallow and breathing procedure where you bite together and the tongue kind of wads up in the top of the mouth and spreads out in there and presses on the palate and develops it out under normal circumstances. And we see that in people that are functioning absolutely correctly. They'll tend to have this expanded upper palate that laps over the lower teeth. And that's the way it's supposed to be. If I just, it's easy here, just make a white deal here, and I'm going to put a couple of upper molars in here. And the lower teeth are supposed to come in and line something like this. It'd be in contact right there. But the upper molar keeps the cheek out away from the contact point, and you don't bite your cheeks. Now, I'm a mouth breather, so my molar teeth, the upper and the lower, almost come in contact here, and my cheek gets in here, and I bite that frequently, so I know this is a fact. So we take this over here. Let's just draw a correct one where the lower molar is coming in like this, and it's got its root structure down in here. I'll try to draw this in a hurry. Now, we get palatal separators from people. You send it in, and I look at the ads in some of the magazines, and they'll band only the 6-year molar and put the palatal separators with just a bar. They'll just have a round bar going back and touching the bicuspids and the maybe the second molar and both the bicuspids be pressed against with a bar. I like to come in and band every tooth that I use in the palatal separator, band those things where they're just rigid. And so when you go apart, like you've got a large lingual root in here, and then you've got a couple of roots on the buccal side, has a couple of smaller roots. It's kind of hard for me to draw those, but the large lingual root comes up in here, and when that upper molar slides back and forth, it rotates off of this lingual root right in here. Now, if we put a separator in and we band this tooth, but we don't band the bicuspids or the molar behind and anything, and we just push on them with a bar, what happens to the teeth when we just go in there and press it with a bar? If I'm going to show you something here where you're just going to push on the tooth with a bar. Let's say this is a bicuspid right here, and we've got this bar is pushing out on this tooth right here. And this one is, of course, coming over here, and say we've got the separator, and this is working off of that, and it's pushing this tooth out. If you actually take a tooth, and we just say we shove on it with a bar down here somewhere. This part of the tooth is in bone structure, all up in here. This is in the air. This tooth will move in this direction, but it will end up kind of like this, and the roots up here will tend to go lingual as the crown goes buccal here. So the tooth will have come, the buccal side of it here won't be touching on the media. The tooth will just kind of tilt over in this fashion. It'll go in this fashion, and I'm going to just draw it a line like we have it here. You shove here, then this line will kind of line up like that. In other words, it'll move this over, and it'll push that crown right. So if you're using a palatal separator and it has only one band, that's the teeth outside of this band. The two teeth next to it will move a little bit along with it, but the other teeth don't. And the roots of the teeth tend to go lingual, and this will crowd up your airway even more. So if you have people make these for you, make them band every tooth in the palatal separator. If you get the two molars and the bicuspids, band all of them. Or if it's just the first molar and the first and second bicuspid, band them. If you really don't up on some of these, we do the cuspid, but most of the time we don't do the cuspid. And if you band those and you seat them good and let them wear it for a while before you cement it permanently, and they're locked in, and where the cement goes up and comes out around the edge of the band up here, and you put your finger over that thing and press it in there real good, and the cement is really around the tooth good, and you separate this, the tooth will have a little lean like this, but then that puts tension on your separator, and you go apart with it, and you hold it out here for several months, and the chewing, that makes the lingual root down here hit more than the buccal root, you see. So you'll be chewing on this part right here more, and that will tend to parallel the roots of the tooth over a period of few months that you wear the palatal separator. All right, let's get back to this particular case. I'm going to have to erase all that, and we'll show you. Now, this young lady breathed through her mouth, and she had her tongue down in the lower arch, breathing over it, so the lower arch widened out more than the upper arch. So you can look at this upper arch. I mean, it is really in like this. And here, down here, I'll put my finger in here, and actually my finger touched these teeth on either side right here. When we got through with it, we had this palate way on out here, and I had a big space between where my finger goes in there. So I can show you that in just a few minutes here. So we'll go to the next picture. She had a space maintainer in here. She lost a tooth, the second deciduous molar, so they banded this tooth. They had a space separator, but it reared that tooth up, and it's not doing really everything it ought to do here. And now, if we look at it, she had almost an edge-to-edge bite and a slight cross-bite in the anterior part of the mouth. And this is raised up, and this tooth's coming in here, and this is up against a baby tooth right there. Now, that baby tooth will go, and this will lay down even further. If you're going to do something like this, just band this and bring it on around and put the same thing over here, and then it'll hold the gap, the airway space, and affect the whole spacing structure on the lower arch will be held much, much better. So this is a panoramic showing. When we got this young lady, she had a lot of baby teeth in her mouth, and over on this side, as far as I could tell, the 6-year molar, it either came in and she had it removed, or she just didn't have an upper 6-year molar. Here's the 6-year molar and the second molar right here. And the 6-year molar should be right in this area, but it's not there. So we had to wait and get this tooth down in here, and then I think we've got a wisdom tooth develop up there to come in and fill that space up. Now here it is a little later. This is 1957, 57, I believe, here. Now we've got a bicuspid here, a molar, a bi, and a cuspid, and this a deciduous, this is a permanent lateral, and the cuspid erupting in here. Similar stuff over here, bicuspid, and there's the bicuspid in here, and a cuspid, and a lateral. It's just piled up on top of one another right in there, in that area. And so let's see what happens to that. later on. Now we're just watching the case. We need those to start. So we told the mother that we needed to go in and spread this palate out. Now on young people we can spread it and the suture comes apart, but I can expand anybody's palate. And you don't have to pull the suture apart, you just expand it. We've got a lady, we just did a video on here a few days back, and she had, the palate is almost a third bigger than it was. And we didn't separate the palate, the sutures at all on it, we just expanded the palate. Now sometimes if the palate's up like this, you go apart and it'll level it, but it can just stretch out. And you can widen that palate, I guess, to any reasonable distance in dealing with this person. So anyway, we did expand the palate in there. Now here, the palatal separator, the separating device, it's in here. And this picture is taken in two sections, and it looks like it's two different palatal separator devices in there. Now this bar goes in, it comes over to here, and this one comes in just on the other tooth right here. We didn't mess with the second molar. This one comes down, and it goes over on two devices like that. Now, when I finished this young lady, I got her out there. I put a bar in there just to hold those teeth in that position, you know. And just hold them out there for a while and keep them in place. And we went in and bracketed in all these other teeth and lined it up in good shape and everything to match it all up. Now, we're using twin brackets now down here. You see the twin brackets, and they take up nearly all the space around on this second tooth, and we've got this in a rectangular wire coming all the way across here. Now there is the palatal separator, you see, up in the back there, and it's pushing all this out and holding it in place. Now let's see our upper teeth now. We've expanded them to where they're kind of laying over the lower teeth, you see, and so we got them in the correct position there. So we can look through in the side of the mouth and see it from here. You can see the buccal cusp of the upper, they extend out over the, this is the second bi and the first molar in there. Now the upper arch is narrow like this, and I think we did 2 palatal separators to get it out where we wanted it to be. And at the time when I took that impression, you didn't see this, but this is a defect that you can put a pencil eraser in there and go right on up into the floor of the sinus up there if you wanted to. And so that's something that when she blows her nose or something, that this would bulge out. And that's where some of the nasal drip and all the, if you've got an infected sinus, it may collect in that area like that. So you need to get rid of that, and we have actually took that out, and then the bone structure filled in to some extent. All right, we've separated this palate this much. You can see how much we separated. Now on the lower arch, we come in and we're going to put a wire in this, and watch what happens in this area right in here. So now we bulge this out to the side, and we brought the other molar up here and brought them in contact, and we just we've got a band, I think, on that tooth back there. I can see this is banded and this is banded, and these deals go all the way back on those teeth like that. Now, we start off with a flexible wire and put that in, and that flexible wire does about 8 or 10 things. It protects against mouth breathing. It kind of helps line the teeth up. If you have a bunch of scouts out there, kind of like we had here just a couple of weeks back, and they seem to love sleeping in these tents and setting them up and doing some cooking out there, learning a few things. But here we're back in the mouth doing stuff that we need to know how to do. Now these teeth are kind of angled like that, so we're going to separate and get these roots over in this direction here and level this out over across in there. Now we go in back here, and I think we had some large molars replaced for moving them to another spot. So here is two of 1920 and 1975, and we've got this palatal separator soldered onto this band and spot welded onto this, and we will fit it in when we get it where we really can slide it all the way to place. We go ahead and slip that in and let the patient wear this for 1 week and maybe 10 days or 2 weeks if we need to. And this kind of gets food stuff packed around, so we have to wash it out with a water pick and everything, keep good care of it. And when you close this up like this, this palatal separator holds them out there, and we're going to have to come in here and kind of round this out and bring it in over on this side too, so you kind of balance that arch out later on. Okay, the bottom arch now is everything is lined up quite good all the way around over here. The bottom arch was wider than the upper arch, if you remember correctly, and now the upper arch is coming out over the lower arch. You can see that from that side. The teeth aren't in contact yet, and there's a little palate in there where one lateral is smaller than the other, but I think we're going to enlarge this one to make it match the one on the left side of the mouth, and the separator will be down in here, and we'll come in and cut these bars off and may cut this and just work on the tooth from out here, and that's how far we widen that palate out. And there's the lower arch widened out, and it's fit. Excuse me. I'm going to have to sneeze. I'll have to take that out in here. Okay, we've got the bite open a little bit doing this, and it will settle back down as we finish it. We take this out and put that bar in there to keep it that way. Now, here, when we started this, I put my little finger in there, and it touched the tooth there, and almost touched it over on this side, and that's where the palate was when we started, and here is where the palate is after we got it expanded. you've got almost the width of the finger between these teeth like that. So we've expanded this a great deal. And I put this bar in there just to kind of hold it. You don't really need that, and I don't do it anymore. We just put that in, and we'll come and put our arch wires and develop the arch out like that. Now this actually pulled the sutures apart in this young kid, but we could take, I've got a case we just did a few days back here on a lady about 50 years old, and we expanded her palate and expanded both arches, to bring it in. In other words, you have a kind of a narrow arch, you expand it, the front comes back like that. And we did that with nothing but a large arch wire, which was way out here. We pulled it in and tied it to these teeth, and we widened all of this up with just this arch wire coming across here and brought that back in. But here's a good illustration of the width that we bought that arch to that size. And now we take it and we're banding everything. We'll close it all up and we'll take her out of that part. Now this young lady had a bony defect right here, about the size of a pencil eraser there. And when we separated this, it didn't change that at all. It just separated right down the middle of it. And that's still in her mouth. You see that the impression presses up in there. And so we've expanded it out that much. And here we're correcting the midline and get a little class 2, and you can see this defect part right there. And the lower's out in that manner. Now back in the 70s, when we got through, we had to close all that band space. You got 2 layers of metal and 2 coats of cement in between every tooth here. And there's a lot of space taken care of like that. So you have to give it a little more torque, and then as you close those spaces, it moves back in some. And this is one of the big reasons we do not use bands, except sometimes on the bottom teeth to hold the hooks, or we may use them a little bit in other fashions, but not anything like what we used to use them. It would go along fine there. Now we pull the rubber band from cuspid to cuspid, and it pulls those teeth together, and we'll kind of leave this alone. And there it is in 1977. We've got lined up like that. These teeth will erupt together, and this will close down. They'll fit in those sockets, and there's your palate. It goes up when you take an impression for a super duper thing, and you get in there, and the impression material will go up in that spot and harden, and so it shows up. All right, there we're in 88, and there it was when it started in 75. Let's see. Now this is 78, and everything is locked in quite good. Now the laser is much easier to, if you upright a tooth with a electrosurge, you just take tissue off the side of that tooth. The tooth is way down in here like this. you go in and uncover the side of it. Then you can put your appliances in here and do the same thing. Pick this up just like we picked up that box of ice cream out there. Now, here is the upper arch when we started. And look at this good now. And there is the upper arch after we've expanded it. So here is the young lady, got a good facial height. Everything is all right. She doesn't have much of an expression on the face. And there is from the side view. We hope you'll join our video, and we have slightly over 5,000 people that subscribe to this. And I definitely don't want to mislead any of you in things that we're doing, but we'll every once in a while uncover something that we hadn't figured out how it would work. And so we'll be taking the flex down and taking the new ones and put them up. So I want to say goodbye, and I'll stop this thing, and we go over here.